morning. My name is Dave Vasquez. I'm a registered nurse. My credentials are I have a Master of Health Administration, I have a Bachelor's in Nursing, and for you folks that are attending Tarrant County, I'm actually an alumni from TCJC back when the day that was going by Tarrant County Junior College. I have a group of students here that are asking about Impetigo, and they're just asking me from my experience. I work at Parkland Hospital as a level 1 trauma center, acute care hospital in Dallas County. Impetigo, to be honest with you, have never seen it. Most likely, the time that I would see it would be if a patient came in with a motor vehicle collision and actually had the disease, and that's probably the time we would actually see it. I work in an acute care hospital. If a patient presented to our facility, obviously what we're going to be concerned about is transmission of that particular bug. It's very contagious. So for us, our infection prevention department would, which is based on guidelines from the CDC, which is the guidelines that we use. And for that particular individual that has impetigo, we will put them in contact isolation. So the question is, what does contact isolation mean, and what does that mean for you as a healthcare worker? If they were in contact isolation, that means that you would have to wear the right protective equipment, and for contact isolation, that would require you wearing a gown and then gloves. You wouldn't have to wear a mask or anything like that, and so forth. So as soon as you enter the room, you would don your gown, your gloves, see the patient, and then when you come out, you just make sure that you do hand hygiene. Hand hygiene, I can't emphasize enough, for y'all folks that are going into healthcare facility, is you need to make sure you wash your hands. That's the key thing to preventing transmission of different bacteria and so forth. As far as once the patient gets discharged, typically that contact isolation only lasts for 24 hours. Once they're starting the regimen with antibiotics, you'll maintain that contact isolation for 24 hours. Once the 24 hours is over of them receiving antibiotics, then we can go ahead and remove the contact isolation. As far as once they get discharged from the facility, then obviously there's going to be a certain way that we're going to clean the room, and our environmental services is very well trained to make sure that we can make sure we clean that room terminally and make sure that no one else gets that particular bug. The biggest thing is just to make sure you're doing hand hygiene in between, making sure that you're not touching your face. I mean, that's key for all of us that are going to be healthcare workers. Please avoid touching your face. I mean, because all of a sudden you're touching the surface and you get that and you can transmit it that way. But for mothers, it's most likely just making sure you do get a hand hygiene, and just watching out for those symptoms on the particular baby. And as soon as you see it, then you take them into the provider and then get it treated as needed. So the question is whether impetigo can cause secondary infections, and really, I mean, when you really think about it, for students out there, if you would ask someone what's the largest organ in your body, most people are going to say like heart, brain, but really, you know what your largest organ is? It's actually your skin, and skin is so important that that prevents you from getting infection. Remember, you go back to that whole cycle of that transmission, that vector, and so forth. Well, skin is one of those things that's a barrier, and impetigo, unfortunately, with the symptomology you get is your skin's broken, it's open, so you are going to be prone to infection. If you keep on letting go untreated, could it get that severe? Yeah, I mean, I would think so. So let's just say that someone that, well, let's just add a little bit more to it. Someone that has impetigo and then they're immunocompromised. The folks I'm thinking of immunocompromised are folks that are on chemo, or they're going through HIV, or maybe they're on steroids and things like that, or even a dialysis patient that could be immunocompromised. So those folks are high risk, and so could they have a septicemia from impetigo? Yeah, there's a high likelihood. So obviously, if in those particular cases or individuals, they need to be just aware of what's going on and make sure they seek medical